At this time, we would like to welcome our brand new chamber members this month. And we will begin with All In Digital. All In Digital is an indoor digital billboard business that was started by Owensboro native brothers Kevin and Corey Jones. They place their large, high-definition advertising panels in high-traffic establishments so that they can easily be seen by thousands of potential customers every single day. And their rates will fit any marketing budget. So please welcome Kevin Jones with All In Digital. Bennett Insurance Agency, LLC, was founded by Dan Bennett in 2016 after working in the insurance industry since 2009. He has been given the opportunity to represent Erie Insurance in Owensboro, Kentucky. Bennett Insurance Agency has great pride in demonstrating the small town feeling of a local agent with the technologies and conveniences of the modern day world. So please help me welcome Dan Bennett of Bennett Insurance Agency. Legacy Owensboro was founded by pastors Jeff and Melissa Phillips 5 years ago to spread the gospel of Christ to hurting people in Owensboro and the surrounding region. Legacy Owensboro has vision from the Lord to minister regionally from the city and is proud to call Owensboro home. So please welcome Jeff and Melissa Phillips from Legacy of Owensboro. QK4 thrilled to announce the opening of the Western Region office in Henderson and their partnership with the Owensboro Chamber. They're a Kentucky-based engineering and planning firm headquartered in Louisville with offices in Henderson, Frankfort, Somerset, Knoxville, Bristol, and Atlanta. The firm's primary business is planning and design of public infrastructure and specializes in water, wastewater, and stormwater systems, roads and bridges, buildings, and park and recreational facilities. So please welcome QK4's Western Region Operations Manager, Rob Campbell, Assistant Vice President, Water Resources Manager, Mike Vickers, and Senior Vice President and COO, David Reed from QK4. And finally, Wilson Family Pharmacy is a locally owned and operated independent pharmacy located at 2315 Mayfair Drive. Wilson Family Pharmacy's goals is to have the residents of Owensboro manage their healthcare needs with minimal cost to them. They want to provide a link between their customers and physicians and insurance providers in order to ensure a positive outcome for all. You're a family member to them and not a number. Their friendly and highly knowledgeable staff will help you fill prescriptions, give face-to-face consults, provide you with your durable medical equipment like CPAP, BiPAP, oxygen walkers, wheelchair supplies, and over-the-counter medications. So please welcome the Wilsons from Wilson Family Pharmacy. At this time, we would like to recognize a special guest and elected officials with us this morning. Jason Hassard is here from Senator Rand Paul's office. City Commissioner Bob Glenn, City Commissioner Debbie Nunley is here with us today. Judge Executive Al Mattingly Jr. is here. County Commissioner George Wathen, Sheriff Keith Kane. And we also, if we missed you, we apologize for that. We do have some other special guests here as well. The brand new CEO of Hospice is with us today. Gay Rogers is here, so a round of applause for Gay. Brand new market president for BB&T just arrived in town, and we're so thrilled to have Bob Turek with us today. And our special guests with Junior Achievement are from the Cliff Hagen Boys and Girls Club, and they're with us today. Oh, there they are. At this time, we would like to recognize our Ambassador of the Month, and that ambassador from Kentucky Farm Bureau is Allison Kimberlin. And Allison, for you, we have a $50 gift card to Peacocks and Pearls. And now with this month's Chamber Update, Candace Brake.
Good morning, everybody. We want to start off with some great news for Owensboro. We all know that Mike Sullivan, who is a former board chair of the chamber and a partner with Sullivan, Mountain Joy, Steinbach, and Miller, was elected as state president of the Kentucky Bar Association. Mike, would you stand for a round of applause? Congratulations. And as his first official act, Mike has actually gotten the Kentucky Bar Association's annual conference to come back to Owensboro. It's been years since it's been here. Mike, thank you so much for doing that for the Owensboro Convention Center and for our community. Oh, we're way behind. Besides workforce development, one of the biggest issues that we hear about from our members that's doing harm to their business are government regulations that are useless government regulations, not the good ones. There are good ones. So Governor Bevin this week has unveiled an initiative that's going to allow business people and other members of the Commonwealth, citizens across the Commonwealth, to report regulations that they feel are doing harm to their businesses or their organizations. Tomorrow I'll send out an email to the membership that will let you know how to report those. This model was adopted from British Columbia in Canada, and Governor Bevin's brought an economist in from that. They actually have reduced their regulations by 45%, and businesses are growing in that province in Columbia. So we're going to be sending out an email that details how to report those. We want to encourage our membership to do that because, as I said, it's one thing that we hear from you consistently that is doing harm to your bottom line. So please do that. Check your email box tomorrow and move forward with that. We really appreciate everybody. It's good for Owensboro to participate in those things as much as we can. So we have a lot going on at the chamber right now. The Golf Classic's coming up on August the 19th. It's presented by Owensboro Health. And we have a lot of sponsors that are here today besides Owensboro Health. Our team photo sponsor is Republic Bank. Our platinum sponsors are Castlin and Hart's Contracting. Our gold sponsors are Riney Hancock CPAs, Atmos Energy, First Security Bank, Wellington Park, Storm Insurance, EM Ford and Company, Owensboro Riverport Authority, Beltline Electric, Alaris, Hafer, Saiho Insurance, the Owensboro Convention Center, Independence Bank, Don Moore on 54, and Tom Watson's Prosthetics and Orthotics Lab Incorporated. There are a couple more gold sponsorships left, but they are going quickly. So give us a call, give Jessica Kirk a call today if you're interested. Silver sponsor is Community Home Healthcare, and host sponsors are OMU FiberNet, Kentucky Farm Bureau Insurance with Gavin C. Roberts Insurance Agency, Chick-fil-A, and Disaster Team. And there are just a few, very few of those left. So please be a part of that. It's a great day. We have a great time, and it's a great opportunity to sponsor and let people know what your business is all about. The Chamber Young Professionals have several things going on this month. Their lunch meeting's July 14th. On July 21st, there's a tour of the Messenger Inquirer where you get to see the back operations of all the really interesting and cool printing things that they've done. They've had lots of jobs in the community recently. So CYP, come out to that. And on July 29th, there's a bourbon tasting. They have a master blender, Drew Mayville, who's going to be at Sazerac. Buffalo Trace is actually where he works. So please come out to that. Check your email, CYP, or the Facebook page, and be a part of that. It's great stuff, and the CYP has really done a lot to have some fun things for them to reach out to one another. Leadership Owensboro applications are now being accepted. The deadline to apply is July 29th. You can find those applications on our website at our office. Give us a call or go on the website. July ribbon cuttings. Today, right after Rooster Booster, we're going to go down to WFIE News to the new location that they have on the corner of the river. We have a whole group of WFIE people here today. Let's all walk down and make the ribbon cutting. They're going to do a video promo for their new station here. So if you're there, you get to be on camera. So there we go. And then today at 12:15, we have Orange Leaf on 54, which is part of the new shopping center that Bill Jones has developed on 54. July the 8th, we have Sam's Club at 9:30. Lots of giveaways at Sam's Club. It should be a fun time. And then July 8th, we welcome Big O Bike Shop to his chamber membership at 12:15. Try to be a part of all those. They're always fun. And then we have some next week. We have a very busy couple of weeks here at the chamber. July 12th, we have Owensboro Family Pharmacy at 12:15. Back Alley Musicals, who you may have heard the Mary Poppins singers singing when you came in today. Their ribbon cutting is 12:15. Those kids are on their summer break. A lot of them had to get up at like 5:30, you know. That's early. That's summer early. July 25th, Edge Fit's having their ribbon cutting at 4:15, and then July 29th, the Rehabilitation and Performance Institute's having their ribbon cutting. You know, if you remember back to your ribbon cutting, how important it is to see a good crowd. It's one of those things, you're celebrating what you're doing, and it's good to see people in the community be a part of that celebration. June renewals are in your chamber matters at your place. Please make note to look through that list and remember that those are people that are investing in your chamber and therefore in the community, and we ask that you do business with them. And John Conti, Gourmet Coffee, back in the back, thank you guys so much for all that you do for us. Great coffee, great tea, and your great community partners. We appreciate you. And Chad, that's all I have for this month. I'm going to go on to the Adams side.
Oh, we're this way. Thank you, Candace, so much. So if we can point your attention to the screens, sort of our introduction for the next guy who's coming to the podium. Very special event coming up July 23rd right here. Suits, sequins, and sneakers we're celebrating today. Also wearing sequins, but you can't see those. So we have a very special guest speaker today who's also our breakfast sponsor, and to introduce him to you, the man on the screen, rocking out the suits and sequins and sneakers, Adam Hancock.
My wife is not going to be happy about that, just so you know. I guess we're just lucky that they didn't catch us or pick the picture with Tom and I in the sequence. That would have been... I want to first thank Owensboro Health for being such a great community partner with us. On a personal note, I did spend some time there Tuesday. My daughter had a tonsillectomy, so I will say the staff, from the time I walked in the door, the nurses were just so great, so I appreciate that. And also thank you for sponsoring this morning. Greg Strahan was named interim president and CEO of Owensboro Health on April 13th, 2016. Strahan has served as COO since 2007. Prior to that, he was Senior VP of Business Development and Community Health Services from 2005 to 2007. Strahan holds a Master of Healthcare Administration degree from the University of Alabama at Birmingham and a Bachelor of Science in Business Administration from the University of Southern Mississippi. He is a member of the American College of Healthcare Executives. Greg and his wife, Susie, have 4 children and 4 grandchildren. That's impressive. Please give a big Rooster Booster applause to Greg Strahan.
Well, it's a pleasure to be here, and I appreciate the opportunity that the Chamber has given us to host this, but also to tell you a little bit about Owensboro Health. Candace asked her how long I had to speak, and she said 20, 25 minutes. And I told her I could probably work about 15 minutes of data into 20, 25 minutes is about it, once you factor in the Mississippi drawl. So it's a little slow. You're a little slow too, so I guess we're all getting it now. So we are honored to be able to sponsor this today and show you some of the facts and figures relative to what's going on in Owensboro Health. But before I do that, I'd like to take the opportunity to introduce some of the key players, if you will, in the healthcare system. And I'll begin with the board of directors that are elected or selected by community, city, county, physician, and community leaders. They spend a lot of time at work. Our board meetings usually last 3 or 4 hours most of the time. So we have a great debt of gratitude for them. So I'll introduce them. Let me see if I can. You got it. Good. So you're with me. Good. I need that. So Debbie Nunley, our chair. Jeff Carpenter, our vice chair, who's not here. Jack Wells, secretary, is also not here. Suzanne Northern Blazer's here. We have Reverend Robert Farmer, Susie Harris, Dr. William Harrison, Dr. Knight, Tom Myers, Dr. Millsaps, Ron Presser, Miss Janice Sherm is here, Terry Woodward's here, and of course Dr. Mike Yauser. So I'd ask you to give them a round of applause for the work that they do. Along with a great board, you also have to have great leadership. I'm not speaking of myself. I'm speaking of the people that we have that are doing the job day in and day out. Many of those are here as well, and I'd like to introduce you to our senior team so that you can be familiar with those as well. They're on the screen. Dr. Sherm is our Chief Medical Officer. John Hackbarth is our CFO. Ward Begley is our Chief Legal Counsel. Mia Suter, our Chief Administrative Officer. Debbie Bostic, our CNO COO. Don Martin is our Senior Vice President of One Health Clinics. Dr. Watson Medley is our Senior Vice President of Medical Staff. Dr. Ed Heath is our CEO of our hospital in Muhlenberg Community, in Muhlenberg at the Owensboro Health Muhlenberg Community Hospital. Roz Cordini is our Compliance Officer. Steve Johnson is our Vice President of Community Affairs and Government Affairs. Dr. Chris Toller, Clinical Integration Officer. Dr. Fran Dufresne, our Medical Affairs for the clinics. Russ Rinaldo, our VP of Finance. Lisa Jones, Dr. Lisa Jones, who is our Vice President of Patient Services. And Dr. Bill Bryant, our Chief Quality and Patient Safety Officer. You'll give them a round of applause. Thank you. You know, we brought our own group just so we'd have some people to talk to, so I appreciate you allowing that. We also have 21 interns that are at the hospital that are doing their summer work there. It's really good for us that they get to work in our institution, get familiar with healthcare in some areas that they're familiar with and that they want to participate in, whether it be pre-medicine, pre-law, administration, marketing, a number of opportunities for them to be involved. So we have 21 of them here somewhere. Would y'all just stand just a minute so they can see how young you are? There they are. Which one? So now we get to talk about the things that we really need to talk about, and that is the meaning of value. Meaning of value is really the next buzzword, if you will, in healthcare. We talk about moving from volume to value, and that is really because of all of the changes in healthcare over the last 3 or 4 years with the ACA, the Affordable Care Act that was put into place back several years back. Also, with the changes that we see on the horizon, the meaning of value has its different meanings for different people. It's certainly, for some people, it's what you get out of that service. If you think you've got a value, you're willing to pay for. For us, it's about service. You know, we serve people. That's our role, that's our job, and that's what we love to do. It's really all about the patients and the people that we serve. But if we look at this particular value, there's more to it than just the patients and just the ones that we serve. It really has to do more with the quality of service that we offer, and the service from that. How safe are we making our patients, and how many convenient locations can we offer? Better access to care, sooner access to care, the right place at the right time. Happens to be the best opportunity for us to deliver a high quality of care. So whether we're healing the sick or working to improve the health of the communities we serve, providing value is the cornerstone of everything that we do. So we have a lot of numbers, and this was a video that we showed our employees during our town hall meetings. We did 21 of those, where we talked to the 4,319 employees that are at Owensboro Health. The information that we gave them was really not about just the size of the numbers, but how involved we are at all aspects of community life even. So with that, the value of quality for us is that we need to continue to raise the bar of quality. We need to continue to push, and we have done that this year by being one of the top 100 hospitals, great hospitals, community hospitals by the Becker Review. In addition to that, we've achieved a level 3 trauma designation verification, and we're moving to a level 2 as we speak. That's a big thing for us, because hospitals are measured on how successful they are by the quality of the work that they can do and what they're able to perform. Level 2 is a level center that we want to achieve, we can achieve, but it's going to take some time. But it allows you and your family to remain in Owensboro for any length of time, certainly because of the seriousness of your injury, not having flown over to Evansville or over to Louisville once we reach that level 2 designation. It should take us about a year to get there, so we're working hard on that. We certainly are continuing to push the envelope on our heart program and our heart failure program, and we're continuing to work with our physicians to develop that. We just added a new physician, Dr. Emcee, that is doing some high procedures that are not currently available in our market, and we'll look forward to having him talk about those at some point in the future, because I think they're really interesting procedures, and it's good to know that you have a high quality of health care there in heart. Along with that, we've been recognized as a top 10% of the hospitals for overall hospital care. Not just individual services, we have a number of those that we're number 1 in the state that we're in the top 5% in the country, but this is overall care for every service that we offer. Then our neonatal intensive care unit started in 2010. With that, when we started that program, it was about 8 beds. Today is 20 beds, and we can take NICU babies up to 27 weeks, as early as 27 weeks with no weight limit. That's critical for people that are having babies and don't want to have to travel, want to be close to the babies, want to be close to the families close to them. And I think if you've ever been to our NICU, you can appreciate the beautiful setting that we have, the ability for families to stay with their children. We have video cameras now that can watch them from home. So there's opportunity here for us to see a continued improvement in the health of the children that we're serving. In addition to this, we've added a pediatric hospitalist program this year. Dr. Eric X, EX is his name, and that will provide a lot of opportunities for us to keep children in our hospital when before we were shipping them to Cossairs or to St. Louis or to Louisville even. So we think this is a great asset that we have at the hospital. I mentioned the 4,000 hospital employees. Pardon me. We're the largest employer west of Louisville. I think that's key for us in our economic drive of the institution here, but also the community. We exceeded our patient safety goals, patient satisfaction goals by up to 90% satisfaction. That's a big move that we've had to try to have employee engagement and to move the needle on patient satisfaction. Because a happy patient will return visit, and they will also share with other people what kind of experience they had, as Adam did. And Adam, I appreciate that free advertisement. So it is a great facility. 26,705 MyChart users to date. And if you're not a part of that, if you go to a physician that has MyChart or Epic, our Epic program, you can see everything that's going on in your health care. You can look at your own record. You can review. You can get notes from your doctor. You can get medication orders. You can do a lot of great things, and I would ask you to check that out if you haven't already. It's a good service. And then we have the foundation that Pat Siri runs, and certainly through our foundation we've supported a number of people, 10,145 in our Owensboro Gives campaign, along with a number of things that we've done through the Owensboro Foundation, Health Foundation. Accessibility, another key component of the value equation, is that we've added the hospital, first hospital at Muhlenberg Community Hospital that Dr. Ed Heath is the CEO of. It's been a great relationship. We've seen a tremendous amount of opportunity in Muhlenberg County and in the southern borders of our region, and certainly we are reaching out to those in a lot of different ways, and I'll show you a couple of those. We've increased volume. That's what you do when you expand. You get more access to more people, and they have more access to health care. We added 33 new One Health doctors that Don Martin and his staff I have onboarded and gotten them in the system and in the region. And I think there's about 20 more that are due to come this next year. So we're continuing to add those. And part of the reason that we're adding those is because of the shortage of health care in primary care and in some specialty care. Certainly, we want to recognize the health part for all they do and the commitment they have to keep us healthy. The 7,446 members that are members there, and certainly half of those are our own employees. We took a stand on that about a year ago that said, you know, if we're going to ask people to get healthy and to do better and to live better and have a better lifestyle, then we need to provide something for our own employees. So this is a program that we've put into place, no cost to our employees. They go to the health park, they log a bunch of hours, we record those. We're part of a vitality program where they can earn points and get gifts and those kind of things for keeping themselves healthy. And we had 23,288 new, and that's the key word here, that there was new One Health patient visits in 2015. It's a big increase, 4%, 24% since 2014, and then most of that's been because of the access points and the physician providers that we've given. Our consolidated financial statement, everybody wants to know how well we do. And John, although it's about a year old now, this is our community report for fiscal year 15. We did $1.3 billion in gross revenue with a net revenue of about $500 million. And you can see the expenses, salaries and wages. And most of us in this room understand the economic impact of that much salaries, right at $250 million, and what that impact is on the economy of Owensboro and the surrounding towns. So our EBITDA, which is what we look at in order to determine how successful we've been and how healthy we are, $71 million. That's after our certainly after we pay our note out of that, our debt out of that, our interest out of that, and those kind of things. But that's a healthy number for most. That's about 14.3% of net revenue. Our community benefit we talked about just a minute ago, and this listed here as our charity, our Medicare shortfall, our community health improvement, our health professional education, our research, and our in-kind services. We give away a lot of money in terms of the grant program Steve runs for us, and it's done so that we might have partners in the community to help us deliver a health care, either a statement or try to fix something, whether it's obesity in the school system, whether it's diabetes education, whether it's smoking cessation, whether it's obesity, period, across our entire counties. So these are good dollars being well spent. 20% of our health care dollars are spent in providing health care. 20% of trying to fix the issues that people have. But where we spend a lot of money is in our partnerships outside of that. And the people's lifestyle make a difference. Because of their lifestyle, these are things they can fix on their own. We're involved in the farmers market, food drives, the 2016 Year of the Child with the CASA, the Habitat for Humanity. We just did 2 homes just the other day and broke ground on those for 2 families that have 4 and 6 children. Everybody deserves that opportunity to have it on their own home. And certainly the opiate threat, which is we just had a series of meetings on at the hospital, and that's a real issue in our healthcare system today. Improving the health of the communities we serve. Most of the needs that we have are in new physicians and new access points. 68% of doctors coming out of medical residency program are looking for an employment, whether it's independent practitioners or whether it's at a hospital or another healthcare system. Only 2% are opening a private practice on their own. So we're always looking to assist our independent physicians, to help them recruit doctors that they need, and certainly for us to fill gaps in the region that we have, whether it's a primary care doctor or a specialty care doctor. Many of you have heard about the waiver 1115 from the state and the impact that it's going to have on the Medicaid program. One thing's for sure is that Medicaid is an expensive proposition. Currently, the old Medicaid program that was there before they put this waiver out, 32% of the state budget is related to that Medicaid program. What will this do? We're in the throes of really reviewing that. You've probably seen in the paper and on the news the town hall meetings that Governor Bevins has done, and over the last 2 or 3, it's been quite a challenge for them to get people to approve this and to buy into this. A lot of questions, and there will be a lot of questions. Changes to the state's $10 million a year Medicaid program is not an easy pill to swallow. Some of them are based on Medicaid dollars that they'll pay as a premium that they'll pay each month. The reduction of benefits are certainly in part of that. And I think it's got a lot of sweeping changes that until we've gone through that entire review of that, can we actually offer a good synopsis of where we'll be at the end of this application. One Health locations, we talked about that. It's a number of, we have 25 locations. We have 75 primary care providers and 111 specialists. New day is dawning. You've seen in the news that we broke ground on 3 health plexes in western Kentucky. Why did we do that? Main reason is the same reason we talked about other access points. The need to have more people accessing health care closer to their homes. All these health plexes, One Health plexes, are along, 2 of them are along the I-69 corridor, one of them in Henderson. And in Henderson, this is the economic impact of the dollars that we'll spend there. $22 million to build the building. It's about 41,000 square feet, and it'll provide these services that you see on the screen. It's right on 1200 Barrett Boulevard, right off of US 60 on the I-69 corridor. Madisonville, same size building, same basic cost, with some impact, a little different impact on the annual salaries, but also the type of physicians that'll be there. We'll have urgent care and general surgery, OBGYN, urology, and certainly the primary care. And then in Muhlenberg, to support our hospital there, they needed a central place for their physicians, 41,000 square feet here in Powderly, in Muhlenberg County, $24 million roughly, and about a $3.3 million economic impact on salaries. So Muhlenberg Community Hospital, that's a picture of it. We've put about $6 million worth of capital in it, we're freshening it up, buying new equipment, doing some brick staining, fixing some things that needed to be fixed. But it is a great facility, and we're proud to be a partner in that facility. Well, that's all the big numbers, and certainly are happy to answer questions. I apologize for my voice this morning. It's not very good, and I can't keep it wet enough to make it through most of it, but I'm happy to answer questions if you have any. I know you've got a small amount of time. Feel free to come by the hospital, call us. We'll be happy to answer those questions, any questions. Thank you very much. Thank you.
One thing that we love here at the Chamber of Commerce is celebrating success, and we know we have a lot of folks with us this morning who came here to celebrate success. So annually, the Kentucky Chamber and the Kentucky Society for Human Resource Management They published a list of the best places to work in Kentucky. And the chamber here, the Greater Owensboro Chamber of Commerce, had so many winners this year that we decided to celebrate today at Rooster Booster. Oh, by the way, and part of this celebration, the businesses that won, you actually have bottles of champagne on your tables, which is awesome. Yeah, they're for work, not here. So take them with you. So let's do this. Let's celebrate these folks who made the list of the best places to work in Kentucky. And the first group, Assured Partners and East Lukens. Where are they? Also, in fact, the next winners are in the Hall of Fame because they have won this award so many times. Atmos Energy. We also have with us this morning celebrating Edward Jones Investments. And Farm Credit Mid-America. We also have the team from Hilliard Lyons with us today. I know these folks are here in force. Independence Bank. Also, Court Therapy, the best in rehab. Also, a round of applause for PBI Bank. And Southern Star Central Gas Pipeline. Van Meter Insurance Group. Let's do this just to show the proportion. Everybody who is a part of those teams that won, stand up. A ton of people in this room acknowledged by the Kentucky Chamber. That is incredible. So give them all a round of applause. Oh, yes. And by the way, we're going to have group photos for you all right after the chamber breakfast this morning, like over here on the side. So if you can get those group photos, it'd be great. Don't forget the ribbon cutting for WFIE. It's going to happen at 9 o'clock at their brand new studio. And a note, if you were not on the list of the places best to work, you work for a business that was not on the list, the businesses that are hiring. So see them, and they'll submit a resume, and you can be honored next year. Y'all, thank you so much. Great to see y'all, and we'll see you in August at Rooster Booster, okay?